So what is hereditary breast and ovarian cancer syndrome? Hereditary breast and ovarian cancer syndrome, also known as HBOC, refers to an increased risk of breast, ovarian, prostate, and pancreatic cancer due to a mutation that is being passed down in a family. Most cases of HBOC are due to mutations in the BRCA1 or BRCA2 genes, also known as the BRCA genes. We get a working copy of the BRCA genes from both of our parents. However, if one of these inherited genes has a harmful mutation, then that can increase the risk for cancer. Women who have a BRCA mutation have up to an 87% risk of developing breast cancer and up to a 44% risk of developing ovarian cancer in their lifetimes. Women who have a BRCA mutation and have already had breast cancer have between a 40 to 60% risk of developing a second breast cancer. Men who have a BRCA mutation have up to an 8% risk of developing breast cancer and a 20% risk of developing prostate cancer. Men and women who have a BRCA mutation may have up to a 7% risk of developing pancreatic cancer. Individuals who have a BRCA mutation have a 50% chance of passing down that mutation to each of their children, regardless of if they are male or female. For this reason, it's very important to test close family members. You may wonder if you even meet testing criteria for HBOC. The red flags that we look for to determine if someone should have testing include a personal or family history of either of these things. Breast cancer under the age of 50? Is there ovarian cancer in the family at any age? Is there male breast cancer in the family? Is there someone in the family who has had 2 separate breast cancer diagnoses in their lifetime? Is there a family history of any of the HBOC associated cancers and Ashkenazi Jewish ancestry? And are there 3 or more individuals on the same side of the family who have had one of the HBOC associated cancers? If you've had testing for the BRCA genes in the past, we now know that there are other genes that can increase the risk of breast and ovarian cancer, and we now offer testing in large multi-gene panels. It may be confusing to know if you meet testing criteria. Luckily, speaking with a genetic counselor can help you determine if there are red flags in your family and if genetic testing is right for you.